Thank you for joining us for the Monday, March 30th update of the Riley County COVID-19 response. My name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan and the lead PIO for the Riley County Emergency Operations Center. Today, we'll hear a brief statement from Local Health Officer Julie Gibbs, and then we'll have some time for a question and answer afterwards. Julie?
Hi everyone. As of today, March 30th, Kansas has 368 positives statewide, with 8 deaths and 39 counties being affected. Riley County still only has 2 positives, and currently in Riley County, we have 1 test pending and are still monitoring 23 people. We have had 45 negative tests so far in Riley County. The governor's order that went into effect on Saturday is very similar to the Riley County stay-at-home order that would have been in place today. The main message is to stay at home. If you do not absolutely need to be out, please don't. I saw a lot of people out yesterday exercising and getting some fresh air and sunshine, and I was very pleased to see most people were practicing social distancing and were together in small groups. If you have questions about this order or whether your business is exempt or not, please email keff@ks.gov. Again, that's keff@ks.gov. As the number of positive cases grow every day and the death toll continues to rise as well, it becomes even more important that we prepare as a community. Our Emergency Operations Center is active, and as an extension of that group, the MHK COVID-19 Clinical Task Force is meeting twice weekly to determine resource needs and best practices, as well as talk about emergency preparedness. I can say with full confidence, we are communicating across the board with our community partners every day, and we are prepared. You can help with our efforts by staying at home. Please avoid public gatherings to protect yourself and others. Please continue to only share valid, reliable information. We have many sources for you to choose from, including our Facebook page, the Riley County Health Department website, the KDHE page, and of course the CDC website. If you have questions, please email us at rileycountycovid19@gmail.com. Again, that's rileycountycovid19@gmail.com. If you are experiencing symptoms such as fever, cough, or shortness of breath, please call the screening line at 785-323-6400. Again, that's 785-323-6400. The days ahead will be long, and though it may be tough to do at this time, please try to stay positive. While enjoying some sunshine myself yesterday, I came across a lot of sidewalk chalk art. I immediately felt comforted by the words I saw. It reminded me that we have such a great community to be proud of. On behalf of the EOC and the County Health Department, I want to say thank you to everyone for your support and cooperation. We strive to keep you safe and informed so that we can continue to be that great community. I'll now take questions.
Can you talk a little about how the governor's order affects the local community?
Sure. So the main message is to stay at home, so only go out for essentials like food, gas, or healthcare. It will affect some businesses that are deemed non-essential and non-medical. Again, you can always check if you're not sure if your business is deemed non-essential or non-medical by emailing that keff@ks.gov.
And is it still okay for people to go outdoors? I know you talked about this. Can you talk a little bit more about that?
Yeah, so the question was, is it okay to still go outdoors? And yes, most definitely. We want you to get out, enjoy some sunshine and fresh air. Please do so by keeping that social distancing, 6 feet between you and another person. Try to avoid large groups. But yes, certainly get out and enjoy some sunshine.
If people think they are experiencing symptoms, what is your advice for that? How do they know if it's allergies or the flu
Yeah.
or COVID?
So the question was, if you are experiencing symptoms, how do you know if you need to be tested? That's why we direct you to that screening call center, 785-323-6400. This was put in place just for that reason and to not overwhelm the healthcare providers or their hospitals. So please make that your first step. That is managed by healthcare professionals that will help point you in the right direction.
I know there have been a lot of folks out, like the teacher parades and the teddy bear hunt in town. Can you talk about advice for people who want to do gatherings in cars?
Sure. We do understand the desire to want to do that. We just want to make sure that you're practicing that social distancing.
Excellent. Where can businesses find information about best practices moving forward?
Sure. Kurt, do you want to?
Hi, Kurt Moldrup, Assistant Director with the Raleigh County Police Department. Each of our officers have with them the best business practices that we've been spending the week handing out. I believe that can also be found on the Raleigh County Police Department's website as well as the Health Department's website.
Now, does this order mean people have to stop working? What does it mean for employers who are not open to the public?
The question was, what about employers or companies that are not open to the public? No, they don't have to stop working. Some can continue to maintain their business from at home. The order allows people to actually go to their closed business if they need to do functions with inside, such as maintaining inventory, etc. So there will be businesses that will be closed that a owner or an employee will need to go into to do some work, but the business itself remains closed.
Are churches allowed to continue to hold services?
Our church is allowed to continue to hold services. And yes, churches are allowed to continue to hold services. Again, we're just encouraging that it be done in a way that we can maintain the social distancing. A lot of them have gone to Zoom and online, but there are other creative ways that churches I know have accomplished this.
For our live broadcast, this change due to the governor's order, how is that going to affect our updates and frequency of updates?
Do you want to?
So the question was, how will this order change our frequency of updates? We have implemented some changes with that, so we will be updating you here every Monday at 4:15 on Facebook Live. I will still do my K-Man broadcast with Dave at 5 every day. Bob Koppel, our CEO of the Via Christi Hospital, is still continuing to do his updates at 7 a.m. With Dave Lewis on K-Man. And then we will continue to do these again on Mondays at 4:15 or as needed.
Do you know when to expect the results from that one pending test?
Results have been taking, the question was, do we expect the results from the pending test? And results have been taking around 4 days.
4 days, okay. Thank you.
You're welcome.
Do you have any other general advice for people in the community?
Other general advice is, like I mentioned before, please stay positive. We are a very strong community and we will get through this.
Okay. Thank you very much.
Thank you.